Hello everyone, I'm Dr. Shilpa practicing at Law RM. Our today's topic of discussion is diastasis recti and physiotherapy. So basically how physiotherapy helps in treating diastasis recti. So what is diastasis recti? So the diastasis recti is the abnormal widening of the space between the two abdominal muscles. Usually it is called as a rectus abdominis. So it has a left part and a right part, and that actually connects with the help of a tissue called as the linea alba. So what happens in this diastasis recti is that the gap between the two abdominal muscles start increasing. It can be due to any reason, such as usually commonly seen in females after post pregnancy, and because the growing uterus puts pressure over the abdominal muscles, and that leads to accommodate that uterus, the abdominal muscles start giving way, and that's how the linea alba starts, the gap between the two muscles starts widening. So that is one thing. Also certain exercises like doing a deadlift or something can also cause it in males. So it can happen in any gender, and it can happen at any age also, because we can never predict where the core muscles go into weakness. So usually it is measured, like as physios we measure it by taking the patient in crook lying, that is taking the patient lying down and then bending the hip and the knee, asking the patient to look forward or bend forward slightly to lift the head up, and we use our finger and try to put it near the belly button. When we do that, we can feel a very evident gap and the muscles surrounding the finger like this. So that feeling will tell us like how many fingers can we pass through. So usually 15 to 25 mm is considered as an abnormal widening, and usually we can't like directly say that, but once we measure it we come to an approximate value. So when we talk about treating this condition, as I said, the abdominal muscles are weak, so our aim should be to treat the abdominal muscles. So usually transverse abdominis is the focus, where we try to do core strengthening, also pelvic floor strengthening. So indirectly it will help in this in getting the gap lesser and help to strengthen the muscles, and eventually it will start coming closer. Also the gap is quite wide in the center, that is near the umbilicus, and it narrows down when it joins the xiphoid like near our chest, and then when it goes further down to the pubic symphysis, that's like a long line which is actually narrow at the two ends and is the most widest in the center. So usually this diastasis recti or divarication of recti is seen mainly in the umbilical area, but it can also be seen in the upper as well as the lower quadrants. Also, when we are talking to the patient, main thing is patient education. They are not aware that they might be having such kind of a situation, and what are the harmful effects. So harmful effects as in, so once the muscle is loosened up, so what happens is that our abdomen also has an abdominal pressure. So any increase or decrease in abdominal pressure can cause hernia, or it can cause the organs to prolapse. So to check that, again what we do is take the patient again in same supine lying, like lying down straight, and we do the same process, and we see something called as peaking. So peaking is the contents of the abdomen coming out through that gap. So we know that the abdominals are further weak. So basic exercises that we can start with is pelvic tilts. We can start with some other exercises like adductor strengthening. So all these are muscular and muscle related exercises will help to strengthen our in and around the abdomen, as well as the also involving glutes and other thigh muscles, which will help in getting the pelvic floor muscles also activated. Sometimes in the early stages, suppose a person has gone through cesarean or something, so in such cases what we do is we ask them to use an abdominal brace. So it is like so we have to measure it first and then order it, like pre-order it according to what quality the patient needs, and so it will help to hold the abdomen properly in a position, so that this pressure on the abdomen is reduced. Breathing exercises and also guide to like how to move around, what is important, what they should avoid. So in the beginning we have to make sure that they are not exerting too much pressure on the abdomen. So we teach them something called as log rolling. So we ask the woman to turn to one side and then get up from the bed, so that if in case they get up straight, then there will be an increase in the abdominal pressure. So to avoid that, we are going to tell them to log roll. Then we have to also inform them that lifting heavy weight can cause increase in the abdominal pressure, and for the very same reason, to prevent any further complications, we are going to advise that as well. So yeah, to wholly summarize this, mainly we focus on the core strengthening, trying to get the abdominal muscles closer, and eventually the gap is going to be less wide, and with exercise and over a period of time it will come quite closer, and much more stability can be established. Maintaining a good posture, that is a very important key, because slouching can also cause increase in the abdominal pressure, and the same thing, the organs can be prolapsed. So as physios, our main important role in diastasis recti is patient education and a comprehensive approach towards understanding what the patient needs and training them accordingly. So thank you very much.